I'm James Field. I'm a Program Director at Whatu Ora Health New Zealand. And most recently in the last year, I've been working with ServiceNow to the rollout of all ServiceNow to all our service desks across the nation.
Excellent, thank you.
And I'm Kate Tulp, and I'm the Country Manager for ServiceNow Aotearoa New Zealand.
Thank you, Kate. And so, it sounds like you've undergone a bit of a digital transformation journey, and undergoing that is always a process and requires resources and time and attention. And I feel like it sounds like you're at a point of reflection. Tell me a bit about what that journey has been like in implementing ServiceNow into your setting.
It's actually, a fitting way to talk about it. It's a real reflection point now. We set out a year ago to address some of the challenges we had across the service desk. So I think the most common terms I'm hearing while I'm here is siloed and fractured. And when I joined a year ago, it definitely was that. We had 16 service desks working in different ways on different systems, and we really lacked an understanding what they were doing and how we could drive value for the clinicians. So that was the real kind of starting point for us, and we set a vision of how do we unify that, get it all in one place and have the data available for us to make the decisions to improve how we act, but also, by that point, even a year ago, AI and that was coming through, how do we actually get ourselves into a sound position to benefit from some of those and move forward with it? So, reflecting on where we were a year ago, it was a challenging environment.
And so, I'm trying to picture if not for the solution, then what would the situation be? Like really kind of drilling into that problem to solve. I guess, what does that, now you're at this point, what does that transformation look like into where you've gone to now, if you get what I mean?
From, right on the onset, we said, look, we're going to do a crawl, wall, run kind of approach to it. And where we are now is crawl. But when I kind of reflect on what does crawl mean, what has it actually given us an advantage? It's given us a single view of our network. We can see where the work is, we can see where the demand is, we can find ways to improve and use the technology we have to drive that. But on top of that, we start to set ourselves up for, what comes next. How do we actually go with technology moving so quickly that we're actually in the best position to, deliver even more impact for the clinicians.
Yeah, absolutely. And, from the ServiceNow perspective, working with Health New Zealand and helping with that transformation journey, it doesn't sound like something that's a jump online and, subscribe yourself and set yourself up. There's a fair bit of process and understanding the problem to solve. How does that fit in with, the services that ServiceNow provides, and what does that mean for you?
Yeah, so we are incredibly proud of the journey that we're on together with Health New Zealand. Health New Zealand has been an incredibly important organisation that we've worked with for a number of years, pre-merge of them all coming together and now as this one bigger entity. It is an incredibly important project that James was talking about. It might sound like it's a really standard foundational kind of thing to roll out one national service desk, but the way that James and the Health New Zealand team have done it has been nothing short of extraordinary. So I'll tell you a little story and you can choose to keep it in or not. So a few years ago, we were running a conference and we had one of our original founders out, Pat Casey, who is an incredibly clever man and legitimately has designed the platform from the ground up. And he was out at this conference and I introduced him to a couple of people from one of the district health boards at the time, and it was pre-merge of all the entities coming together. And we walked away from that meeting and Pat said to me, gee, that's a hell of a project and it's going to be amazing and I believe that they will pull it off, and when they do it will be incredibly important and it will be something that the world will want to know about. And so when we look at what these guys have done, we say it is in fact important. It was important for clinicians to give them back more time to spend with patients. It's really important for employees who maybe aren't clinicians within the hospital environment to be able to access information and get their problems solved quickly, and it's really important for the people who are supporting all of those employees and clinicians and the IT teams to be able to do a great job. So yeah, it's for us super important project.
It's great to be able to put it in that perspective. Look, question without notice and kind of wrap up as well. We've been at Digital Health Week for the last couple of days and I see ServiceNow have got a good presence on the expo floor and I'm sure involved in sharing some perspectives with attendees too. What do you take as the, what would you hope that attendees kind of walk away from the sessions and everything over the last couple of days, particularly given the lens that we've got now of the system that and the situation we're in? What are you hoping that they walk away from the last couple of days with?
Ambition. True, just outright ambition. We're really good in New Zealand at defining the problem and talking about the problem, but there are plenty of solutions and ways that we can get at the things that matter the most in delivering public health care in this country, and we're very excited about that. So I just hope that everybody walks away with ambition and inspiration from coming and listening to people like James and Andrea talking about what they've managed to achieve in a really short time frame at Health New Zealand. And if you can do that across a complex government organisation at pace, then I really believe that anything is possible.
Yeah, no, any thought?
Beautiful, Kate. Ambition is exactly what we're looking for. We've got to think bigger and we've got to get on with the job. So, rather than kind of repeating what Kate said, I think it's, we are all in the waka together. There is not one entity that's going to be able to solve that. And it's a great testimony to ServiceNow. Strategic partner is a bit of a cliche. Everyone puts in their RFPs, everyone says they're going to be their partner, but ServiceNow turned up, understood us, made the decisions that were right for us, created commercial constructs, and every time we went to them with a problem, nothing was a problem. They were always there to fix it. And I think it's that kind of strategic partnering coming in and supporting us that has to happen. And we just need to, how do we create the ecosystem? How do we create the scale around that where everyone here knows that we've got the big problems to address? Let's do it together, but let's start today.